it can be tough all year round, but summer can especially be rough for those who suffer from asthma. So what could trigger it amid the warm weather, and how is it diagnosed? Well, joining me right now is Dr. Daniel Silovitz with White Plains Hospital. Good morning, doctor.
Good morning. Thank you for having me.
Of course. So how exactly, first off, is asthma diagnosed?
So the first step is to go see your physician. They can perform a thorough clinical evaluation, review your symptoms, and they can also perform lung function testing, some of which can be performed in the office.
And doctor, what exactly are the signs of adult onset asthma that patients may mistake for, just getting older versus when you're a child?
Yeah, so adult onset asthma often presents with a persistent cough, wheezing, chest tightness, or the feeling of difficulty expanding the lungs, especially during exercise or at night. And these symptoms shouldn't just be chalked up as aging. They're worth evaluating.
And so we're already in the middle of summer at this point, middle of July. What exactly, what environmental triggers, rather, do you need to watch out for this season in particular?
Sure. So high pollen levels, mold, high humidity, and air pollution, especially during those hot, stagnant summer months. In addition, smoke from wildfires, which has become more common recently, is a big trigger for asthma sufferers. So it's a good idea to check air quality reports and limit outdoor activity during those high-risk days.
And finally, doctor, what are some simple prevention tips to keep symptoms under control, not just during the summertime, but year-round?
Sure. So most important is know your triggers and avoid them if possible. Using air purifiers at home or at work can be very helpful. Keeping the windows closed during peak allergy season can also be helpful. And of course, take the medications prescribed by your physician and stay on top of the vaccinations, such as the new pneumonia vaccine. These can help avoid an asthma exacerbation.
All right. Well, Dr. Daniel Silovitz with White Plains Hospital, thank you so much for joining us today.
Thank you for having me.